I'm demonstrating how to do a taping technique to the bottom of the foot. This is for patellofemoral pain, and we are testing the waters for the use of an orthotic, basically. So um, there's three clinical predictor rules that we're looking at with patellofemoral pain syndrome and the use of an orthotic. We're looking at a 4-foot valgus alignment that's greater than 2 degrees. Not having at least 78 degrees of toe extension, and then less than 3 millimeters of navicular drop. So basically what that means is this person is a heavy pronator. They're using the arch of their foot for the majority of the impact during loading response and gait. So we're trying to essentially take off some of that load during gait to hopefully decrease that knee pain. Now, most insurances won't cover the use of an orthotic until we prove that something like this would work. So this is just essentially a technique that we can use to show insurance companies that could be a successful treatment. So what you see here is that I have my patient's foot plantar flexed and his toes are flexed in a relaxed position. What I did was cut out strips of tape here, and what I did was I attached the anchor to the base metatarsal, wrapped it around the calcaneus, making sure that I'm not getting on the Achilles tendon here, and then anchored it back up on top on the opposite side. So I'm basically going to show you how I did that. So I'll start at the first ray, and we're going to come down around, slightly tense it up. We're going to bring it around the calcaneus, and then across the midfoot, and reattach it at the 5th metatarsal. So we kind of get plantar fascia. It's acting like plantar fascia. Next thing we're going to do after we get about 3 or 4 layers of that is we're going to do what's called a U shape to support the foot. So we'll start on the base of the 5th. And we're going to go down, around, same principle here. This time I have a larger piece of tape. It's not a half cutout. We're going to go down across the first. And anchor that down. If I had more tape, I would do multiple pieces of that. And then we want to apply the support. So you want to be careful that you don't, when you apply these next pieces of tape, that you don't squeeze tarsal tunnels so that you get Morton's neuroma. So this is essentially, we're not applying pressure here, this is just a cover piece. So we're going to go from here across to cover what we've done, which is essentially reenact the windlass mechanism of the foot. Oops. And that, ladies and gentlemen, is all the tape I have. So now we're going to go to pre-wrap. What I would do is I continue applying the tape on the bottom, and then essentially what I'm going to do is turn the foot over, so I put him in a seating position, and then cover the top of that. For this purposes, we're just going to use the pre-wrap to close it up. Again, I'm not applying too much pressure here. What I would do to assess if this works or not is just to have him stand up, make sure it stays intact, and then have him walk. Make sure we keep it on for a couple days. We probably have to reapply it after about 3 days, but we should see an immediate decrease in knee pain with that.